HSG Test Vs Laparoscopy, which is best for fertility. When it comes to understanding fertility issues, choosing the right diagnostic test can feel overwhelming. Both hysterosalpingography and laparoscopy are key tools doctors use to find out what's affecting a woman's chances of conceiving. But which one is better? Well, it really depends on what your doctor suspects and your individual situation. Hysterosalpingography, or HSG, is a less invasive procedure that you can have as an outpatient. It involves lying on a table while a small tube is inserted into your uterus. A special dye is then injected, and X-ray images are taken to see if the dye flows freely through your fallopian tubes. If the tubes are open, the dye will pass through easily. This test is good at detecting blockages or abnormalities in the uterine cavity, like scar tissue or uterine shape issues. It is usually less expensive, doesn't requiring anesthesia, and can be done quickly. However, it has some limitations. It cannot directly see the pelvic organs or detect conditions like endometriosis or pelvic adhesions. Sometimes, spasms or insufficient dye flow can lead to false positives, suggesting a blockage when there isn't one. Laparoscopy, on the other hand, is a surgical procedure performed under general anesthesia. It involves making a small incision near the navel and inserting a tiny camera to look directly at the pelvic organs. This allows doctors to see the uterus, fallopian tubes, ovaries, and surrounding tissues. Laparoscopy is considered the most accurate way to diagnose issues like endometriosis, pelvic adhesions, or other hidden problems that might not show up on an HSG. It also allows for immediate treatment, such as removing endometriosis lesions or breaking up adhesions during the same procedure. But it is more invasive, requires hospital stay, and carries risks associated with surgery and anesthesia. From a fertility perspective, laparoscopy offers a major advantage because it can identify and treat conditions that HSG cannot detect. Endometriosis is a common cause of infertility and often requires direct visualization for proper diagnosis. If initial tests like HSG suggest a problem, or if there is suspicion of endometriosis or pelvic adhesions based on symptoms, laparoscopy is usually recommended. In summary, HSG is a good first step because it is simple, affordable, and effective at checking if the tubes are open. If the HSG shows abnormalities or if there is a high suspicion of pelvic disease, laparoscopy provides a more comprehensive look and the chance to address issues right away. The best approach depends on your specific health history, symptoms, and the advice of your fertility specialist. Always consult with a healthcare professional to determine the most appropriate diagnostic plan tailored to your needs.